Question 1. A patient presents to the emergency department with a sprained ankle sustained while playing basketball. The coder selects a code for sprain of ankle. What is a key piece of information the coder must verify to assign the most specific ICD-10-CM code? A. Whether the patient is right or left-handed. B. The specific ligament or joint involved and the laterality, right or left. C. The time of day the injury occurred. D. The patient's insurance provider. Answer: B. The specific ligament or joint involved and the laterality, right or left. This question tests your understanding of ICD-10-CM specificity, particularly for injury coding. The keyword most specific is a critical clue, indicating that simply coding sprain of ankle is insufficient. ICD-10-CM requires codes to indicate the specific anatomical site affected, such as a particular ligament, and whether the injury is on the right or left side of the body, if applicable. For example, a sprain of the right anterior talofibular ligament requires a more detailed code than just ankle sprain. Always look for details about the specific location and laterality of an injury to ensure you select the correct, most granular code available. Question 2. A patient sees their primary care physician for a routine annual physical examination. The physician performs a comprehensive history and exam and provides age-appropriate counseling. What category of CPT codes would typically be used to report this service? A. Evaluation and management, E/M, codes. B. Surgery codes. C. Radiology codes. D. Pathology and laboratory codes. Answer: A. Evaluation and management, E/M, codes. This question asks about the classification of a common physician service, testing your knowledge of CPT codebook sections. The description, routine annual physical examination with physician services like history, exam, and counseling clearly falls under the category used for physician office visits. Evaluation and management, or E/M, codes are specifically designed to report the cognitive work performed by physicians during patient encounters, including preventative services like annual physicals. CPT is divided into sections based on the type of service performed, and E/M services are distinct from surgical, radiology, or laboratory procedures. Remembering that E/M codes cover the thinking and examination time doctors spend with patients will guide you to the correct section. Question 3. A coder is assigning a code for acute appendicitis. What is the primary classification system used in the United States for diagnosing conditions like this? A. CPT. B. HCPCS Level II. C. ICD-10-CM. D. DSM-5. Answer: C. ICD-10-CM. This question focuses on the purpose of different coding systems, specifically which one is used for reporting diagnoses. The key phrase, coding for acute appendicitis, refers to reporting a medical condition, which is the function of diagnosis codes. In the United States, the International Classification of Diseases, 10th Revision, Clinical Modification, ICD-10-CM, is the standard system for classifying and coding diagnoses, symptoms, and procedures related to health encounters. CPT codes are for procedures and services, HCPCS Level II is for supplies and non-physician services, and DSM-5 is for psychiatric diagnoses. Think of ICD-10-CM as the language used to tell the insurance company why the patient was seen or treated. Question 4. A patient receives an injection of a chemotherapy drug in a physician's office. In addition to the E/M code for the visit and the CPT code for the injection administration, what other type of code is required to report the drug itself? A. An ICD-10-CM code for the drug. B. A CPT code from the medicine section. C. A HCPCS Level II code. D. A radiology code. Answer: C. A HCPCS Level II code. This question tests your understanding of reporting drugs and supplies administered in a healthcare setting. The crucial element is reporting the drug itself administered in an office setting, distinct from the administration service. HCPCS Level II codes are used to report products, supplies, materials, and certain services not included in the CPT codebook, and this includes many injectable drugs administered in outpatient settings. While CPT has codes for the injection administration, a separate HCPCS Level II code is necessary to report the specific chemotherapy drug product and quantity used. Remember that HCPCS Level II often covers everything else not found in CPT, especially drugs and durable medical equipment. Question 5. Which modifier is used to indicate that a surgical procedure was performed bilaterally, on both sides of the body? A. -25. B. -50. C. -79. D. RT. Answer: B. -50. This question assesses your knowledge of common CPT modifiers used to provide additional information about a service. The keyword bilaterally specifically refers to a procedure performed on both the right and left sides of the body during the same operative session. Modifier -50, bilateral procedure, is the standard CPT modifier used for this exact scenario. Modifier -25 is for a significant, separately identifiable E/M service on the same day as a procedure. -79 is for an unrelated procedure by the same physician during the postoperative period, and RT indicates the right side only. When you see a procedure done on both sides, immediately think of the -50 modifier. Question 6. A surgeon performs a complex repair of a rotator cuff tear. According to CPT guidelines, what is typically included in the global surgical package for this procedure? A. The initial consultation before the surgery. B. All unrelated E/M visits during the postoperative period. C. Routine follow-up visits related to the surgery during the defined postoperative period. D. Physical therapy services provided after the surgery. Answer: C. Routine follow-up visits related to the surgery during the defined postoperative period. This question tests your understanding of the CPT Global Surgical Package concept. The Global Package bundle includes services typically performed before, during, and after the surgery by the surgeon, but only those directly related to the surgical procedure itself. Routine, uncomplicated follow-up visits related to the recovery from the surgery during the specified postoperative period are a core component of the global package. Initial consultations, unrelated E/M visits, and ancillary services like physical therapy are generally not included and are reported separately. Understanding the global period means knowing which follow-up care is considered part of the original surgery payment. Question 7. A patient undergoes an X-ray of the chest, 2 views. Which section of the CPT codebook would a coder look in to find the appropriate code? A. Surgery. B. Radiology. C. Medicine. D. Anesthesia. Answer: B. Radiology. This question asks about the CPT section for imaging services. An X-ray of the chest is a diagnostic imaging procedure. The radiology section of the CPT codebook is specifically dedicated to procedures involving diagnostic imaging, therapeutic radiology, and nuclear medicine. The other sections cover surgical procedures, various medical services, like injections or tests, and anesthesia administration. Anytime you encounter an imaging service like an X-ray, MRI, or CT scan, the first place to look in CPT is the radiology section. Question 8. A coder sees the abbreviation SOB in a patient's medical record documentation. What does this abbreviation commonly stand for? A. Study of the brain. B. Shortness of breath. C. Surgery on the back. D. Swelling of the bone. Answer: B. Shortness of breath. This question tests your knowledge of common medical abbreviations found in documentation. While some abbreviations can have multiple meanings, SOB is a very frequently used shorthand in medical records. In the context of patient symptoms, SOB almost invariably stands for shortness of breath, indicating difficulty breathing. Familiarizing yourself with common medical abbreviations is crucial for accurately interpreting clinical documentation and selecting the correct codes. Pay attention to the context in which an abbreviation is used to confirm its meaning. Question 9. A patient is admitted to the hospital with pneumonia. The physician documents pneumonia due to Streptococcus pneumoniae. What is the importance of the phrase due to Streptococcus pneumoniae for ICD-10-CM coding? A. It is irrelevant and can be ignored. B. It indicates the patient is allergic to antibiotics. C. It provides necessary information to select a more specific code indicating the causal organism. D. It means the pneumonia is not infectious. Answer: C. It provides necessary information to select a more specific code indicating the causal organism. This question highlights the importance of documentation detail in ICD-10-CM coding, specifically regarding infectious diseases. The phrase due to Streptococcus pneumoniae identifies the specific bacteria causing the pneumonia. ICD-10-CM codes often require documentation of the causative organism for infectious conditions to achieve the highest level of specificity. Coding simply pneumonia would be less precise than coding pneumonia specifically due to Streptococcus pneumoniae. Always look for documented cause and effect relationships or specified infectious agents, as these details are essential for accurate ICD-10-CM coding. Question 10. A physician performs a minor procedure in their office. The patient's condition required a significant, separately identifiable E/M service on the same day as the procedure. Which modifier would be appended to the E/M code? A. -51. B. -25. C. -59. D. XS. Answer: B. -25. This question tests your understanding of modifiers used when both an E/M service and a procedure are performed on the same day. The key phrase significant, separately identifiable E/M service on the same day as a procedure is the defining characteristic for using modifier -25. This modifier indicates that the E/M service was distinct from the decision to perform the minor procedure or the typical pre- and post-procedure work. Modifier -51 indicates multiple procedures, -59 indicates distinct procedural services, and XS is a HCPCS Level II modifier for a separate organ/structure. Remember that modifier -25 is specifically for separating a distinct E/M service from a procedure on the same day. Question 11. When assigning an ICD-10-CM code, what does the seventh character often represent in injury and external cause codes? A. The patient's age. B. The location of the injury on the body. C. The episode of care, initial, subsequent, sequela. D. The severity of the injury. Answer: C. The episode of care, initial, subsequent, sequela. This question focuses on the structure and use of the seventh character in certain ICD-10-CM categories. For many injury and external cause codes, the seventh character is mandatory and provides information about the episode of care. A typically represents the initial encounter for the injury, D represents subsequent encounters for routine care during the healing phase, and S represents sequela, or complications or conditions that arise as a direct result of a previous injury. This character is crucial for tracking the patient's progress and the stage of care for injuries. Always check the tabular list for required seventh characters, especially in the injury and external cause chapters. Question 12. A patient is diagnosed with hypertension and chronic kidney disease. The physician documentation states that the hypertension is causing the chronic kidney disease. How would a coder approach coding these conditions in ICD-10-CM? A. Code only the hypertension, as it is the primary condition. B. Code only the chronic kidney disease, as it is the most severe. C. Code both conditions and assume they are unrelated. D. Code both conditions using a combination code or separate codes indicating the causal relationship. Answer: D. Code both conditions using a combination code or separate codes indicating the causal relationship. This question tests your understanding of coding conditions with a documented cause and effect relationship in ICD-10-CM. When the documentation clearly links one condition as causing another, it is essential to reflect this relationship in the coding. ICD-10-CM often provides combination codes for conditions with a common etiology, or separate codes that allow for linking the cause and manifestation. Simply coding them independently or ignoring the relationship would be inaccurate. Always look for documentation stating one condition is due to, of, or with another, as this indicates a need to check for specific coding guidance or combination codes. Question 13. A patient presents for a follow-up appointment after a recent hospitalization. The physician reviews the hospital course, examines the patient, and adjusts medications. The documentation supports a high-complexity medical decision-making, MDM. For an established patient in the office setting, what is the key factor in selecting the appropriate E/M code based solely on MDM? A. The time spent with the patient. B. The number of organ systems examined. C. The level of complexity of the medical decision-making. D. The patient's insurance provider. Answer: C. The level of complexity of the medical decision-making. This question focuses on the criteria for selecting E/M codes for established patients, particularly when using medical decision-making, MDM. For office visits with established patients, coders can typically choose the E/M level based either on the time spent or the complexity of the MDM, provided the documentation supports the chosen level. The question specifically mentions solely on MDM and that the documentation supports high-complexity medical decision-making. Therefore, the complexity of the MDM is the key factor in selecting the code in this scenario, independent of the time spent or the extent of the exam. Mastering MDM components, number of diagnoses/management options, amount/complexity of data, risk of complications/morbidity/mortality, is crucial for accurate E/M coding. Question 14. What is the primary purpose of HCPCS Level II codes? A. To report physician services and procedures. B. To report diagnoses and diseases. C. To report products, supplies, materials, and certain non-physician services. D. To report hospital inpatient procedures. Answer: C. To report products, supplies, materials, and certain non-physician services. This question asks about the role of HCPCS Level II in the coding system. HCPCS Level II, unlike CPT which focuses on physician services, is primarily used to report items and services not covered by CPT. This includes things like ambulance services, durable medical equipment, prosthetic devices, and supplies used in the provision of healthcare. While CPT covers the physician's work, HCPCS Level II often covers the things and other providers involved in patient care. Think of HCPCS Level II as the coding system for everything from crutches and wheelchairs to certain drugs and non-physician healthcare provider services. Question 15. A coder is abstracting information from a pathology report for a biopsy of a skin lesion. What is one of the most crucial pieces of information needed from this report for accurate coding? A. The patient's height and weight. B. The name of the referring physician. C. The definitive diagnosis of the tissue examined. D. The patient's primary language. Answer: C. The definitive diagnosis of the tissue examined. This question emphasizes the essential information needed from a pathology report for coding purposes. A pathology report provides a microscopic examination of tissue, and the definitive diagnosis is the pathologist's conclusion about the nature of that tissue, e.g., malignant melanoma, benign nevus, inflammatory reaction. This specific diagnosis is critical for selecting the correct ICD-10-CM diagnosis code. Patient demographics or referring physician information are important for billing but not typically for determining the pathology diagnosis code itself. The pathologist's final diagnosis is the most authoritative source for coding the condition found in the tissue sample. Question 16. A patient is seen for a laceration repair. The physician documents a 5 cm simple repair of a laceration on the patient's arm. In CPT, what is a key factor in determining the correct code for laceration repair? A. The patient's age and gender. B. The length of the repair in centimeters, complexity, simple, intermediate, complex, and anatomical location. C. The time it took to perform the repair. D. The type of sutures used. Answer: B. The length of the repair in centimeters, complexity, simple, intermediate, complex, and anatomical location. This question tests your knowledge of the key elements that drive code selection for surgical procedures like laceration repair in CPT. Laceration repair codes are highly specific and are determined by 3 main factors: the total length of the repair in centimeters, the complexity of the repair, simple involves a single layer, intermediate involves 1 or more layers of subcutaneous tissue and superficial fascia in addition to the skin, and complex involves more than just layered closure. And the anatomical location of the wound, e.g., face, scalp, trunk, extremities. Ignoring any of these factors will likely lead to incorrect code assignment. Always extract the length, complexity, and location from the documentation to select the appropriate laceration repair code. Question 17. In the context of anatomy and medical terminology, what does the term proximal mean? A. Away from the point of origin or attachment. B. Toward the front of the body. C. Toward the back of the body. D. Closer to the point of origin or attachment. Answer: D. Closer to the point of origin or attachment. This question tests your understanding of directional anatomical terms, which are fundamental to coding and understanding medical documentation. Proximal is a term used to describe a position that is closer to the point of origin or attachment, such as the torso or the midline of the body. For example, the elbow is proximal to the wrist because it is closer to the shoulder, point of origin for the arm. This is the opposite of distal, which means further away from the point of origin. Understanding these terms is essential for accurately interpreting anatomical descriptions in operative reports and other medical records. Question 18. A patient presents to the emergency department with chest pain. The physician orders an electrocardiogram, ECG or EKG, and a chest X-ray. What type of service are the ECG and chest X-ray considered in the context of medical billing? A. E/M services. B. Surgical procedures. C. Ancillary services. D. Preventative services. Answer: C. Ancillary services. This question asks about the categorization of diagnostic tests like ECGs and X-rays in billing. Ancillary services are supportive services other than direct patient care provided by a physician, including diagnostic tests, like imaging, lab work, and ECGs, and therapeutic services, like physical therapy. While the physician's evaluation of the patient's chest pain is an E/M service, the tests ordered to help diagnose the cause are considered ancillary services. Recognizing which services fall into the ancillary category is important for proper billing and coding. Question 19. A coder is reviewing documentation for a patient with type 2 diabetes mellitus with diabetic neuropathy. In ICD-10-CM, how is the relationship between the diabetes and the neuropathy typically coded? A. Code the diabetes only. B. Code the neuropathy only. C. Code the diabetes and the neuropathy separately without indicating a relationship. D. Code the diabetes and the neuropathy using combination codes or codes that link the conditions. Answer: D. Code the diabetes and the neuropathy using combination codes or codes that link the conditions. This question reinforces the concept of coding related conditions, specifically focusing on complications of diabetes in ICD-10-CM. Diabetic neuropathy is a common complication of diabetes, and ICD-10-CM provides specific codes to reflect this causal relationship. There are combination codes that include both the type of diabetes and the specific complication, or separate codes that are designed to be used together to show that the neuropathy is due to the diabetes. It is incorrect to code them as unrelated when the documentation indicates the neuropathy is a result of the diabetes. Always refer to the ICD-10-CM index and tabular list for guidance on coding diabetes with complications. Question 20. What is the primary use of the CPT codebook? A. To classify diseases and injuries for mortality and morbidity statistics. B. To provide a uniform language for describing medical, surgical, and diagnostic services and procedures. C. To list supplies and durable medical equipment. D. To classify mental health disorders. Answer: B. To provide a uniform language for describing medical, surgical, and diagnostic services and procedures. This question asks about the fundamental purpose of the CPT codebook. The current procedural terminology, CPT, codebook is published by the American Medical Association, AMA, and is the standard for reporting physician and other healthcare professional services and procedures. It provides a systematic listing of codes and descriptive terms for these services, ensuring consistency in reporting across the healthcare industry. ICD-10-CM is for diagnoses, HCPCS Level II is for supplies and non-physician services, and DSM-5 is for mental health disorders. CPT is your go-to resource for coding the work done by healthcare providers. Question 21. A physician dictates that a patient has osteoarthritis of the right knee. When coding this in ICD-10-CM, what is the significance of the word right? A. It is not significant for coding osteoarthritis. B. It indicates the severity of the osteoarthritis. C. It is essential for selecting the correct code to specify the laterality. D. It means the osteoarthritis is bilateral. Answer: C. It is essential for selecting the correct code to specify the laterality. This question emphasizes the importance of laterality in ICD-10-CM coding for musculoskeletal conditions like osteoarthritis. ICD-10-CM codes for many conditions, including osteoarthritis, are specific to the side of the body affected. Documentation stating right knee or left knee is crucial for selecting the correct code, as there are distinct codes for right, left, and bilateral involvement. Ignoring laterality will result in less specific, and often incorrect, coding. Always look for and report the laterality documented by the physician. Question 22. A coder is assigning codes for a surgical procedure. What is the most important documentation source for selecting the correct CPT code for a surgery? A. The patient's history and physical. B. The physician's office note. C. The operative report. D. The discharge summary. Answer: C. The operative report. This question focuses on identifying the primary source document for coding surgical procedures. The operative report is the detailed, dictated account of the surgery performed by the surgeon. It includes critical information such as the pre- and post-operative diagnoses, the procedures performed, the surgical approach, findings, and details of the repair or excision. While other documents provide context, the operative report provides the most complete and accurate description of the surgical work performed, making it the essential document for CPT coding of surgeries. Always code surgical procedures from the operative report. Question 23. A patient is seen for management of chronic obstructive pulmonary disease, COPD, with acute exacerbation. In ICD-10-CM, how is an acute exacerbation of a chronic condition typically reported? A. Only the chronic condition is coded. B. Only the acute exacerbation is coded. C. A single code or multiple codes are used to report both the chronic condition and the acute exacerbation. D. The acute exacerbation is coded first, followed by the chronic condition. Answer: C. A single code or multiple codes are used to report both the chronic condition and the acute exacerbation. This question tests your understanding of coding chronic conditions with acute exacerbations in ICD-10-CM. When a chronic condition has an acute exacerbation, it means there is a sudden worsening of the chronic condition. ICD-10-CM typically provides specific codes or requires the use of multiple codes to capture both the chronic nature of the condition and the presence of the acute exacerbation. For COPD, there are specific codes that include the acute exacerbation. It is crucial to capture both aspects of the patient's condition when documented. Always check the ICD-10-CM index and tabular list for specific guidance on coding chronic conditions with acute exacerbations. Question 24. In medical terminology, what does the suffix ectomy mean? A. Surgical repair. B. Surgical removal. C. Surgical creation of an opening. D. Surgical crushing. Answer: B. Surgical removal. This question tests your knowledge of common surgical suffixes in medical terminology. The suffix ectomy is a frequently encountered suffix that means surgical removal or excision of an organ or part. For example, an appendectomy is the surgical removal of the appendix, and a tonsillectomy is the surgical removal of the tonsils. Understanding common suffixes like ectomy is very helpful in deciphering the meaning of surgical procedure names and selecting the correct CPT codes. Question 25. When reporting services using CPT codes, what is the purpose of using a modifier? A. To change the meaning of the CPT code. B. To indicate that the service provided was altered by specific circumstances but not changed in definition. C. To report the diagnosis associated with the service. D. To indicate the provider's specialty. Answer: B. To indicate that the service provided was altered by specific circumstances but not changed in definition. This question asks about the fundamental role of CPT modifiers. Modifiers are two-character codes appended to CPT codes to provide additional information about the service that was performed. They don't change the basic definition of the CPT code itself but indicate that the service was performed under specific circumstances, such as being bilateral, a multiple procedure, or part of a global package. For instance, modifier -50 doesn't change what a knee replacement code means, but it tells the payer that the procedure was done on both knees. Modifiers are essential for accurate billing and communication with payers about the specifics of the services rendered.